Thanks. I'm very happy to be here. It's great to see so many people in the audience. And I want to actually acknowledge, just starting off, that I'm going to be talking about some work that I'm doing with one of my core collaborators who's actually on the main stage right now. So, scheduling always works that way. So Dr. V is one of my main collaborators, but he's running the panel right now on social media. So I want to talk to you today about 4 main topics. What do we know about health literacy? What do we know about eHealth literacy, which I also often call digital media literacy or digital health literacy. I'm calling it eHealth literacy in this talk right now. What do we still need to learn about eHealth literacy? And most importantly, how can we learn it and from whom? Okay. So what do we know about health literacy? Here's a definition from the Institute of Medicine. It's a pretty dry definition, but I think that it captures some really key points about health literacy, which is that it's about getting information, understanding it, and being able to use it to make good health decisions. What else we know about health literacy is that at least 80 million US adults have low health literacy. And this means that they have decreased access to care, and they're at higher risk for poor health outcomes. Specifically, the poor health outcomes that they're at risk for include increased hospitalizations and emergency care, lower rates of mammography screening, lower rates of influenza immunization, lower ability to take medications properly, to interpret medication labels, to interpret health messages. This also leads to a lower overall health status among the elderly, and higher mortality rates among the elderly, and higher racial disparities in health outcomes. So all of these things have been clearly linked to low health literacy. Also, a lot of studies have shown that health literacy is actually a stronger predictor of a person's health than their age, income, employment status, education level, and race. So that's a pretty powerful indicator right there, I think. Now, in contrast to the negative effects of low health literacy, we also know that patient engagement is a very powerful predictor of health in the positive direction rather than the negative direction. So engaged patients achieve better health outcomes across the board, pretty much. And a question that I want to pose today is whether engaged patients equal eHealth literate patients. Does health literacy automatically come as part of engagement? And I see someone already shaking their head no, and I would agree with that, and we'll get there in the talk, and I think that's a really important question to be thinking about right now. So what do we know about eHealth literacy? Okay, we do know that engaged eHealth consumers, and so I would say that is ePatients, among other kinds of people, feel better prepared for clinical encounters. They ask more relevant questions, they know more about their healthcare, they're more likely to take steps to improve their health. Compared to people who do not use eHealth resources. Here's a definition of eHealth literacy. It's fairly similar to the IOM definition of health literacy, being able to find, access, understand, and critically appraise health information. So it's not just about finding information, but about assessing its legitimacy and its value in relation to your particular needs, and then apply that to addressing or solving a health problem. In a workshop from a couple of years ago, the IOM recommended that for health literacy, they weren't looking at eHealth literacy here, just for health literacy, that social media and other kinds of tailored communication are good strategies. In fact, they were their #1 strategy for elevating the level of health literacy in this country. In February, the journal Health Affairs called patient engagement the blockbuster drug of the century. I don't know, probably a lot of you saw this issue, and I want to just read out the first paragraph here, where this is an editorial by the editor Susan Dentzer, who says, "Even in an age of hype, calling something the blockbuster drug of the century grabs our attention. In this case, the drug is actually a concept, patient activation and engagement, that should have formed the heart of healthcare all along." So there's clearly some great potential linked with the possibility of patient engagement, and the question is, what does this have to do with eHealth engagement and with eHealth literacy? So what do ePatients know about patient engagement? A lot. I think anyone who was here yesterday heard that loud and clear. What do ePatients know about eHealth literacy? I think also a lot. But the question is, how can more patients become ePatients? How can that kind of literacy and fluency be disseminated more broadly and be something that more people have access to? So in this context, I want to shift now to just talk about a couple of things that I'm working on with my collaborators at the Medical Futures Lab, which is a collaboration between Rice University, Baylor College of Medicine, and the UT Health System, the medical school, and the other health profession schools in Houston. And one of our core premises with the work we do is that there are no more passive consumers of information in the digital age. And because of that, we need new competencies for 21st century learners. That includes eDoctors and ePatients. And what this really means is that we need to think differently about how we create content for consumers of health information. And those consumers include doctors and patients. And one of the really important ways we need to think about that is by using transmedia storytelling, using different forms of media to capture a story across different kinds of platform to capture the way that health occurs beyond the clinical encounter. We heard a lot of discussion yesterday about the fact that the time that a patient spends with their doctor in the course of a year is a tiny, basically invisible gold dot, right, in this matrix of blue dots. And so we really need to think about how to capture the health story that includes all of those blue dots as well as that one little gold dot in a meaningful way for doctors and for patients. So we take a lot of inspiration from this comment by Howard Rheingold in his book NetSmart, which came out last year, which I've used for teaching pre-med students. And he said when you start engaging in knowledge or media production, you tend to develop a much more sophisticated understanding of how knowledge and media is produced more generally. So it's really about actually getting involved in producing information and content as a means of learning. And this is a strategy that we use in all of the stuff that we do at the Medical Futures Lab. So two things that I want to tell you about. One is an event that we did this past summer, which is laying the foundation for another series of events that are coming up. And the event this summer we called it a Transmedia Hackathon, and it was a 2-day event that we did at the Oshman Engineering Design Kitchen, which is a design space at Rice where engineering students were doing a intensive summer class. And I took over with several of my colleagues from the Medical Futures Lab, MDs and artists and communications experts, and we talked about and worked with the students on the process of engineering design using words and images as opposed to the kinds of tools that they use usually to make physical prototypes. So the goal of this event was to explore the relationship between an idea and the way that you represent that idea as a means of finding a solution to a problem. And what this is all focused on really is the fact that most medical problems at their core are communication problems. They're social problems. That's not to say there isn't a huge biomedical component of medicine that is essential and is a foundation, but many of the problems that people are talking about here are communication problems surrounding the biomedical problem. So we wanted students to explore communication by really thinking about what the tools are that make up communication practices. So students engaged in experiments using different kinds of communication and representational tools. I'll talk about them in a minute. And this was to develop an understanding of how the form of a representation, the way that you represent information, actually shapes the ways that we can ask questions, analyze, and solve a problem. So we gave student groups tasks of different kinds of problems to solve using written, visual, moving image, and audio tools. And then at the end of the hackathon, these student groups presented their experience of experimenting with these different tools and talked about which tool was most helpful to them in solving the problem. Here are a few of the sample problems that some of the groups addressed. How to capture the patient narrative in the EMR. So, we were having them tackle really big problems, obviously. We didn't expect them to solve them, although they came up with really impressive solutions in a short amount of time. These were rising sophomores, too, so these are not medical students. They don't actually have clinical experience. How how to explain to an illiterate patient the benefits and risks of getting her genome sequenced, how to convey socially uncomfortable advice to a patient, and how to talk to a patient about end-of-life preferences. I wanted to just mention, we didn't do this problem, but this is the one that I'm most excited to tackle, though I think I would most like to tackle it with medical students, and that's to get them to really try to think through how to help a doctor, this would be a doctor who isn't already on board with this, understand the meaning and importance of a patient's self-tracking data and help the patient, help the doctor transform the data into actionable information. This is a desire that I hear from many quarters, and that people would love to be able to have their doctors do, but a lot of doctors don't know what to do with that information, and a lot of patients don't either. Okay, so some of the things that we did a series of exercises that we called Doing Things with Words, where we used metaphor and analogy and also point of view storytelling and visual storyboarding to try to capture the process of experiencing whatever problem it was that these student groups were working on. By doing this, they found that really if you surround engineering with art and listening and storytelling, you respond to your users' needs in a much more direct way. The students didn't have time to go out and actually do research with their user groups in the course of this intensive experience, but that would obviously be an important part of it. So all of this whole process was basically laying the groundwork for a project that we're launching in January of 2014 called the Medical Media Arts Hub, which is really going to be a space where health providers, health professionals, and patients, any key stakeholder in the healthcare space, will bring a problem that's a communication problem in some way or a visualization problem to work with a team of students on solving that problem through the sorts of exercises that I was just talking about that we did in the hackathon, but we would do it over the course of several months. In this, it would be a kind of iterative design process where we have feedback from additional stakeholder groups, additional patients in the community, additional healthcare professionals, and other users, end users of the tool that they will ultimately develop to solve these communication problems. And the key to this is that it's not just about finding a solution to this particular problem, it's also about health professionals getting reverse mentoring on being eDoctors, patients getting to shape their relationships with their providers through a collaborative design process, and really at the end of all of this, what we're focusing on is bringing together the process of co-creation with patient engagement to not only achieve better health outcomes, but to also empower doctors and patients to work together in different ways as a result of learning this process of co-creation together. So this is the approach that we're taking right now to working on developing digital media literacy, eHealth literacy for future doctors and future patients. And I welcome any comments or questions. Thank you.